I'm a Mayo Clinic trained board-certified pathologist, board-certified in anatomic and clinical pathology. So yes, I have expertise in immunology and virology. I also have subspecialty expertise in skin pathology, so I do a lot of skin cancer diagnostics as well. I've seen about 350,000 patients in my career. We've done about 100,000 COVID tests in the past year, so it is right up my alley, and so I'm not just blowing smoke today. This is my area of expertise. So I want to be able to share with you today actual science. You know, we get a lot of politics from one side, the other side. I'm not here to offend one side or the other. I'm here to speak data, and the data speaks the truth. And so I have no agenda. I just want people to understand, one, what public health messages have we been missing? You know, what treatment should be available to everybody? I want to talk a little bit about the quote vaccines, and then I want to open it up to questions, because I could talk on this for probably 3 hours or 3 weeks. Average COVID-19 death age, 78.6. Average age of death in North America every year, 78.6. That's fascinating. What are our highest risk factors? Obesity, low vitamin D levels. All right, biggest lost message on this entire pandemic is vitamin D. There is no such thing, and if I can give one message to all of you for every winter and autumn for the rest of your lives, there is no such thing as flu and cold season. There is only low vitamin D season. Next, please. Vitamin D, every cell in your body, every nucleus has a receptor for vitamin D on it. 2,000 genes in your body are controlled by vitamin D. 5% of your body's genome controlled by vitamin D. It is the master key to your immune system, the master key. If one has a level in mid-range, you cannot develop a cytokine storm. Data shows what kills people? Cytokine storm. If you are in mid-level range, you will not die from COVID because you cannot get a cytokine storm. Next, please. All right, so we don't just have a viral pandemic, we have an international vitamin D deficiency pandemic, i.e. 70% of the world is immune suppressed. 70%. 70 to 80% of all Americans are immune suppressed because they are D deficient. 82 to 88% of nursing home patients are D deficient. Who's dying at the highest rate? Nursing home patients. 83% of African Americans, 70% of Latinos, 72% of Native Americans, 47% of Caucasians are insufficient, and 70% are deficient, and well, 47% are deficient, 70% of Caucasians are insufficient. 80% of all hospitalized patients statistically are vitamin D deficient. 96% of people in the ICU are vitamin D deficient. If you are D deficient, you are immune suppressed, you are susceptible to the common cold, the flu, coronavirus of any sort, bacterial pneumonia, et cetera, et cetera, et cetera. The best mask of all is a healthy immune system, and a healthy immune system does not occur, next slide please, if you don't have D in normal range. Well, how do we get D? Sunshine. You know, we synthesize it through our skin. Above the 35th parallel in the world or below the 35th parallel for 4 to 5 months of the year, you cannot synthesize vitamin D through your skin. The older you get, the harder it becomes as well. Vitamin D is critical. Every Idahoan, if you do not supplement, you are vitamin D deficient, you are immune suppressed in the fall and the winter. Next slide, please. So here's a good map of the 35th parallel. Anybody above that line is vitamin D deficient all winter long. So, you can run outside naked thinking you're getting sunshine from October through March, like this fine gentleman here in the snow, and the amount of vitamin D you will synthesize from October through March outdoors running naked in your tutu is zero. Absolutely zero. If you do not supplement with vitamin D in the wintertime, you are immune suppressed. All right, is there a treatment for outpatient COVID? Is there a treatment? You know, unfortunately, the three-letter federal government agencies have practiced therapeutic nihilism, apathy, complete apathy. No, gosh, if you get sick, go home. If your lips turn blue, then go to the hospital. If you can't breathe, go to the hospital. When in the history of medicine have we said to someone, well, gosh, you have pneumonia, but once you're sick enough to be hospitalized in the ICU, we'll give you an antibiotic for your pneumonia? Insanity. Insanity. We as physicians have collectively lost our medical minds. Just saying, well, gosh, yeah, you have an illness that we know is killing people around the world. Why don't you just go home and see how you do? Insanity. The earlier you treat, the more complications you can decrease down the road. And you know what? There's a treatment. Unfortunately, if there's a treatment for a disease, the federal government cannot approve a vaccine by law, by rule. So the NIH, who is involved in approving medications, they co-hold the patent on the, quote, vaccine with Moderna. If the fox is not guarding the hen house there, I don't know who is. That also is insanity, to have the government in bed with a private company vending a product that they want to give to everybody. And so when they look at the potential, quote, therapeutics, hydroxychloroquine I'm not going to talk about because pretty controversial. I have my opinions. I took it for 10 months. I swabbed thousands of sick people. I never got COVID. So that's my story on that one. There's a better medication. I'm going to discuss that next. Conflict of interest, federal government in bed with a vaccine company. Absolute conflict. They don't want a therapy to work because then they can vend their vaccine. However, next slide, please. They've tried remdesivir. 6 months ago, the World Health Organization said, stop using remdesivir. It does not add survival rate to anybody. $3,000 a pop. What are our hospitals still doing? Giving remdesivir. When does remdesivir work? The first 2 to 3 days of disease when the virus is replicating. By the time you're hospitalized, you are in a hyperimmune phase of a disease. Your immune system is what the hospitalists are trying to tune down. Remdesivir, again, it's like peeing on a forest fire. It does nothing at that point because the virus is already maximally replicated. Remdesivir, expensive, of benefit to the pharmaceutical companies in their back pocket, of no benefit to your health. Convalescent plasma, when does it work? The first 2 to 3 days of disease when the virus is replicating. Do people get that outpatient? No, they don't. They only get it in the hospital when it's not effective. Monoclonal antibodies, when do those work? The first couple days of disease when the virus is replicating. By the time you're in hospital, when the virus has reached maximal replication, does it work? No, it doesn't. Do steroids work? To a degree they do once you're at an inflammatory stage in the hospital, yes.